greetings of the season and welcome back to my channel. This is Nurse UC. All right, so I've been dealing with the psych mental health, okay? So, and then today we're going to talk about one of the tools, the greatest tools we use in the psych mental health, which is what? Music. So music therapy is a therapeutic approach that uses music to address physical, emotional, cognitive, and even the social needs of individuals. And it is often facilitated, by a trained music therapist. What I mean by that, like a board certified trained, therapist that can come in a facility like that or in a hospital, and they can involve, listening to music, creating music, singing, and moving, to music. So this type of therapy can be used in a variety of settings, including hospitals, school, like I mentioned, and even rehabilitation centers and mental health facilities, right? So can we look at the benefit of music therapy? Basically, if we dive into the benefits, number one will be emotional well-being, right? So basically this, entails like helping reduce the stress, the anxiety, and depression by creating a calming and uplifting environment, pretty much. And then number two to look at, it's the physical benefit. Remember the number one was emotional well-being. Now those physical benefits, number two, can assist in pain management, improve motor skills, and enhance physical rehabilitation. Now let's look at the third one, which is the cognitive improvement. Cognitively, it has been proven that it boosts memory. Right? Music boosts memory and attention and problem solving abilities, especially in conditions like the dementia or brain injury. Now, I'm hoping that you know what we mean by dementia. Like if a patient has a loss of memory and it has deteriorated to the point that they can't function anymore without anybody's help. Like on the early stages, like Alzheimer's, but when it progresses to the dementia, that's really bad and deterioration. So basically the fourth benefit we're gonna list out here, it's the social connection, promotes good group bonding and improves communication skills, and especially for individuals with autism or social anxiety. Have you ever noticed like an autistic patient, you give them, earpiece with the music, it makes them, really, I don't know how to explain, but I have really worked with autistic patients though. They, tend to love music. It's very therapeutic for them. And then the fifth one, it's the spiritual healing. So this provides a means for expressing and processing emotions and aiding in spiritual or emotional healing as well. So guess what? We have like some techniques used in music therapy. So let's look at the techniques, that you can use. The number one will be active participation, meaning that everybody needs to do what? Participate. Now, playing instruments, singing, or even composing music. And then number two is the receptive method. So when you look at the receptive methods that we have, like listening and analyzing music to relax or explore emotions, it's really good. Now, let's look at the number three, which is the improvisation. Creating music spontaneously to foster creativity and self-expressions. Now, let's look at the number four, which is the movement to music, using music to guide physical movement, which can enhance coordination and motor skills. Now, who can benefit? The question comes, who can benefit from all these things I have listed? Individuals with chronic illnesses or pain. So if someone is experiencing a lot of pain, just put music. You see the wonders. Now, secondly, people with mental health for, disorders. For example, the PTSD, like I mentioned, which is the post-traumatic, stress, disorder, and then depression or anxiety. Then the third category is like children and adults with developmental disorder, for example, ADHD or even autistic patients. Now, when you look at the second to the last, which is patient in palliative care or hospice, I hope you guys know what I mean by that. Like palliative, it's like when they are basically being rehabilitated or they're in hospice, just like end of life program where they go and from there people comfort them. It's just a palliative care. I don't know how else I can explain that. And then lastly, older adults with dementia or Alzheimer's, that I have explained before, So that's pretty much, where I'm gonna start on this section. So do well to subscribe to my channel, okay? And share and subscribe, share, put on your notification button so that whenever I come, live or I create video, you'll be able to see my videos, okay? So we'll see you soon. Bye.
Thanks for watching. Subscribe to Nurse UC YouTube channel.